What does Jewish law say about medical care on Shabbat? Imagine a day of rest suddenly interrupted by a life-threatening emergency. What does Jewish law say about stepping outside the usual rules to save a life? Let's explore how health and healing fit into Shabbat. Jewish law places a high priority on saving lives and protecting health. The core principle called Pikuach Nefesh means saving a life overrides almost all other commandments. If someone is in danger, medical care is not just allowed but required on Shabbat. This includes actions like giving treatment, administering medication, or even performing surgery if needed. When a person is seriously ill or there's any doubt about their condition being life-threatening, all restrictions are set aside. For example, lighting a fire or using electricity, which are normally forbidden, are permitted if they are necessary to save a life. The idea is that preserving life takes precedence over resting or observing restrictions. Even if the illness isn't immediately life-threatening but could worsen or cause serious harm, medical intervention is allowed. For example, if someone has a limb that might be at risk, treatment can be provided. In such cases, non-Jewish helpers can be asked to perform forbidden actions, but Jews may do so with modifications called shinui, doing the action in an unusual manner, to lessen the violation. For illnesses that cause discomfort but aren't dangerous, the law is more lenient. Still, unnecessary violations of Shabbat are avoided unless the health of the person is at risk. Before Shabbat begins, preparations like setting up medical equipment or medications are encouraged to reduce the need for forbidden actions during the day. Rabbinic authorities emphasize that even in uncertain situations, it's better to provide care and risk violating Shabbat than to ignore a potential danger. The concept of chasidit shel sh warns against refusing necessary treatment out of excessive concern for Shabbat rules, as this could endanger life. Jewish law clearly distinguishes between kole she'ein bo sakana, a sick person without danger, and kole sheyesh bo sakana, a person with danger. The latter always justifies violating Shabbat for treatment, while the former allows some leniency but generally avoids unnecessary violations. In practice, Jewish patients and caregivers can feel confident that seeking and providing medical care on Shabbat is permitted and often required when health is at risk. When urgent, Jewish individuals may act directly, especially in life-threatening cases, even if it means violating some restrictions. Hospitals and clinics serving Jewish communities often have protocols to respect Shabbat while ensuring necessary care. This includes unknown preparations and awareness of halakhic guidelines. Consulting a rabbi or Jewish medical ethics expert can help navigate complex situations, but in emergencies, saving a life always takes priority. In the end, Jewish law teaches us that health and life are treasures worth protecting at any time. When it comes to medical care on Shabbat, the guiding principle is clear. Do what is needed to save a life, because preserving health is a fundamental value that surpasses restrictions.